Usisahau kusubscribe, kulike na kucomment.
It is a chilling sight, a mass grave, rows of coffins as burials quadruple in New York. This is Hart Island, where the bodies of those with no known family are temporarily interred, some simply unable to pay for a funeral. On the 7 line, more signs of the cruel inequity of COVID-19. Many of the passengers are black and Hispanic. New data suggests they're twice as likely to die from the virus than white people.
These are mostly communities that are impoverished, have poor healthcare access. It was as if the pre-existing health disparities made them more vulnerable, and then also their jobs are exposing them to the public and to being sick.
Everybody calls us the front line, but we're the last line.
Captain A.J. Briones says he's responding to calls from every age, every ethnicity in Yonkers. But he does think space and money are playing a role too.
You're looking at poorer areas, where the poorer areas, you have a lot of people in a small environment versus, say, you live in a suburban neighborhood. It's you and your family in your home, and that's it.
Gonna be for the COVID positive.
Then comes a call.
303 received, responding.
These days, AJ is often the first at the scene.
3 Larry Temple.
In New York State, 17% of those who die from coronavirus are black, despite representing only 9% of the population. This patient is from another heavily affected group.
She's struggling to breathe, so they're taking her to hospital. She's also Hispanic, and it is the Hispanic community in New York City which has the highest death rate amongst COVID-19 patients.
A few miles away, an exhausted front line unites, but they've seen disparity too.
Anybody who has what we call comorbid disease, diabetes, hypertension, heart disease, anything like that is more susceptible to this disease, and it tends to be more lethal. So in that population, we often know that there's a fairly high prevalence of diabetes and heart disease.
In America, there are no daily figures on race and ethnicity in this pandemic yet. Without them, it will be harder to focus resources and ultimately save lives.
Usisahau kusubscribe, kulike na kucomment.